about the journey that you've had from to get you here today to consider doing this case and kind of what it means to you. And
my wife made me do it.
Your wife made you do it, right? Right?
No, it's been one of those things where, you know, for years I have always been conscious about dental work, and I've always gone to the dentist. And I think at some point I was having a problem with gum disease, and then that led to gum reduction surgery. And then from that point it was, okay, every 3 months we're going to have your teeth cleaned. And I've been doing that for 10 or 12 years.
Wow.
And so while I was more concerned about having the teeth stay in, I wasn't so concerned about the cosmetic aspect of it and what they look like. It was just as long as I could chew and they weren't leaving me, I was in good shape. I mean, I got into a fight when I was 21 years old, and I caught a good right, and the guy broke my cheekbone. Well, I thought I won the fight until about half hour later, you know, and wound up having the cheekbone had to be fixed. But there's probably some scar damage or some tissue damage that, you know, wasn't repairable, that may have thrown my jaw and my bite out of alignment.
And
I
you've
never
noticed,
addressed it too.
yeah, and you've noticed over the years that you don't open straight, you kind of open to the side, and
Never noticed that.
and you have also haven't noticed until recently that the wear is very angular, and
Right, yeah,
it's all starting to make sense. The puzzle's coming together.
It's been such a gradual process. I mean, it's like the teeth just didn't all of a sudden wear out in the last couple of weeks where it would be noticeable.
Right.
It's just been very slow over a lot of years. And then one of the other things that happened to me when I was young is I broke my front tooth right in half. And that wasn't a fight, that was, I slipped in a pool. And the pool was very shallow and smacked my face on the bottom of the pool and broke my tooth in half. And they put this crown on, and that's what all of my teeth used to look like.
Smile big forth. Yeah.
You know, and so now what's happened is as I've gotten older and my teeth have discolored and they've worn down, that crown is really apparent, and that's probably the most noticeable aspect of my teeth. You know, so if we can make them all look like that, we'll be fine.
So. We're aiming to not only improve the cosmetic, but also to improve the function and prevent further wear, so you can keep your teeth the rest of your life.
Yeah, that's the idea. The thing that's been so much interesting for me is somebody that works in construction, and I'm a bricklayer, and I work with my hands, and I know the process of putting a building together and how attention has to be paid to all the details. And then you compare that to what we're doing here. We're building a new set of teeth. And so the foundation has to be right, so okay, we got the roots straightened out, so that part of it's working pretty well. So now the process of sitting in this chair and watching you people do your jobs of rebuilding a smile is an interesting thing to watch. It's been very, very amazing to see the technology you use, the lasers, the way you measure things. Not a whole lot different than building a building, I guess, but smaller scale. You know?
That's good. So Bill, this is the chewing simulator that we have put your casts on, and this is the wax up of what we're going to get. And we discussed that over the years you've reduced the vertical dimension by wearing down your teeth a good 5-6 millimeters. And so you can see how we're giving you that back. And eventually we'll restore these posterior teeth as well, but there's enough stable teeth here in your new bite that you'll be looking better and functioning better, and so you won't just have one crown that stands out anymore. So I think it's going to turn out beautiful.
It looks
I'm
good.
excited.
It looks good.
So welcome back, Bill. It's good to see you. It's been 2 weeks since we delivered the case, and you're back for some final little adjustments, but mostly we want to just know how you're getting along with that new smile, that new bite, and tell us how it's been.
It's a whole lot different. You know, it's amazing. You know, that the reaction you get from people when they see you. I went home and my wife she'll walk around and say, "Let me see your teeth." You know, so.
And we had sent her a little picture before you left the office a couple weeks ago, saying that you were all done, and tell us what happened with that picture.
Well, she got the picture, she looked at it, and she put it on her Facebook page, and by the time I got home, she had like 14 people that already responded that they liked my new smiles. I'm getting great reactions from people. They're totally blown away by the difference. You know. So.
Well, it was really fun to work with you, and now we'll just anticipate taking good care, having you take good care of what you got there, and keep them in good shape, and keep them for the rest of your life.
Hope so.
Rather than the track you were on, wearing them out. So, we're happy.
A little better looking than they were.
Yeah.
The people at work, they just are totally blown away by what they see. You know, so.
Your personality.
Yeah, so your personality is a lot of, you know, people get judged by their appearance.
Mm-hmm.
And it's one of those things where your appearance is part of your personality.
Right, right.
And so it is, you know, if you got a really ugly smile, you don't smile too much. So
That's a good point.
it's a different thing. So
So you think you're smiling a little more these days?
probably.